there's a lot of people with opinions and thoughts around doing cosmetic treatments, right? And what that means about you, or, people who will stand strongly and be like, well, I've done nothing, and feel really great about that.
Listen, all of this stuff can be done amazing, and it can all be done really poorly.
Feeling guilty about it's not helping anybody, because I'm just feeling guilty all the time.
My 9-year-old said to me the other day, do you still help people, or do you just make them prettier?
We're really obviously excited to have Dr. Katie Beleznay on with us. She is well known in the aesthetics world as just literally one of the best in the business. She also is so interesting because I know her a bit personally. I'm fortunate to have that honor and pleasure. And so today we are going to talk about a lot of different things. And yes, we're going to talk about aesthetics and all that, but there's a lot we want to know about Katie. And just as a quick preview, Katie is very much into longevity. She's on her own personal journey there. So we're going to want to probably dive into that a little bit too, Katie. So Katie, welcome.
Thank you. I'm so excited to chat with you both. When I heard you were doing this, I was like, oh, this will be fun.
That's because Ben swears a lot, and that's why this thing is going to be so much fun. So expect a lot of F-bombs in this interview.
Well, I'm trying to clean it up. Like I told you, I think we're supposed to bleep them. We'll see. TBD on that. Yeah. That's why I said BFD, Dom. I didn't want to,
Ben, no one should harness.
I don't want to get us in trouble.
Bring the F-bombs.
Okay, listen, Katie, let me jump in, Dom, because I think we're still kind of figuring out exactly what this is, Katie, but it's the More You pod. We're trying to figure out how to get more you, more us, more everybody. And Dom really wanted to focus on people that were making people get the best out of themselves, obviously aesthetically, professionally, personally. So he was like, dude, Katie's a rock star. You're obviously making people beautiful, but you have this vibe that you can tell your patients love you, and you bring that out in them. And it really is about getting the best you. And then I wanted to learn from you from the longevity perspective. This is a fake beer, for the record. I just had a super stressful day. So yeah.
That's what he does, Katie. I don't know. I got no idea why he's doing that with the fake beers, but he does.
I love them. I love beer, and I'm trying to drink less real beer, so I'm drinking fake beer.
I really would like to get to Katie, Ben, but quick, Ben's like, everybody knows Ben's this incredible surgeon. He's sporting a broken arm. And then he tells me, he's like, hey, the good news is it's not my surgery arm. So I'm totally okay. You have obviously so much experience, but I think the thing I want to just ask right out is people think, getting cosmetic procedures is, there's a stigma out there. I think that people think it's not embracing aging. And it's not aging gracefully or any of those kind of things. And I know you have strong feelings about this. And I just want to let's start there before we talk about all the amazing things you do. Let's just talk about this premise first.
Yeah, it's so tricky because there's a lot of people with opinions and thoughts around doing cosmetic treatments, right? And what that means about you, or, people who will stand strongly and be like, well, I've done nothing, and feel really great about that. But I think it's so individual, and how you choose to age and what you embrace. And, I find a lot of patients who come in and it's part of their self-care. Like they just want to feel good in their skin, just like they might get their hair done or buy a new shirt. Like this is part of that holistic approach to aging, and it's their choice with aging. And so, I'm the believer of trying to support and embrace, I guess, everyone's own way that they choose to age. And if this is something that makes them feel good, I'm like, all the power to you, right?
Yeah. So why do you think people, why do you think there's a hate on now for this?
For aesthetic treatments in general, I think it's sometimes driven by people who don't do aesthetic treatments, right? Like they want to be the loud voice that says that their way is better or, quote, more natural or whatever they may choose. And so sometimes those voices will be louder amongst the noise around. And so that will make people feel either judgment or I'll find patients come in and they almost are like ashamed and feel like, oh my gosh, I'm being so vain. And I feel badly that they have to feel that way because they don't, it's their own choice, right? But there are some loud voices on the other side. And I think right now in the industry, because you talked about now in particular, there's some pushback on treatment, celebrity culture, filler. We've chatted about this where people are like, oh, but it looks done, or you're no longer yourself, and like those sort of comments. And so people kind of lump aesthetic treatments all in with that. And it's kind of blurred about what you can do to feel good and what the decisions and choices you have in the aesthetic space are that might feel good for you, right? That don't need to be all in. They can be small little steps that make you feel good.
That really gets to your vibe, Katie. And for those of that didn't catch the about, Katie's in Canada. She's a leading dermatologist in Canada.
Jeez,
I don't know if we did a
Canada
proper
shaming us. Did you?
Yeah.
Oh my
No.
gosh.
I was just saying for those other
that.
people out there that didn't pick up on that, I think it's important. You're North America's #1 dermatologist. But my vibe is much more, hey, you got to pay if you want to slay. There are plenty of approaches, right? That people, what I like to say, there's so many hot people walking around out there that you don't know are seeing Katie and me, and you know what I mean? Everybody's like, oh, everybody out there is looking. Well, no, there are people that look. There's so many people that are killing it that just kind of walk around like nothing's happening.
Yeah. Sorry. Comment on that. And then I have a question. After.
No, it's so true, right? Like I don't like most people. And I'd say, I'm in Vancouver, right? It's very like West Coast, like hiking, natural, like people don't want to look, quote, done, right? They want to look like what they feel is the best version of themselves and they don't want people to know, right? So that is the goal, right? Like I don't, it's not that someone's like, oh my gosh, you got your lips done. Like that's not often the goal of my patient population, I'd say. So most of it is that quote undetectable aesthetics, right? That subtle little bit just to like not turn back the time all the way, just like you be you and feel really good and be like, like this frown line is setting in and I'd like to soften it and kind of reverse time a little bit there where I'm looking a little grumpy and that's not how I feel. So those are like the little subtle things that I find many of my patients at least are looking for. But yeah, you're like much more direct. I'm maybe a little more of a fence sitter there on that.
There's somebody for everybody. That's
right?
really the key.
Yeah.
What I like, Katie, that you use the word tweakment, because I think that actually nails it. It's it's not this huge grand change that you're bringing about. It's this subtle things that you're doing to make somebody not only look better, look younger, but feel better, feel younger, right? It's a big part of that.
Yeah, a lot of it, as we talk about, is like the emotion and how people feel, right? And the confidence that they may have from doing some procedures. And yes, like some people may need the more dramatic transformation, as Ben can probably attest to in a lot of the world that he does. And that's amazing. And that's what they want. And that makes them feel good. And we're like, okay, great, like supportive, And then some people are just like toe in the water. They're just doing like little things. It might start with a skincare regimen. It might, build on that to a little bit of, quote, baby Botox, as I talk about, and kind of go from there. So I think it's so individual and our patients' feelings about aesthetics are so individual. And so a lot of it, I think in my space is just normalizing kind of what we do, right? And, the analogy is like, some people are like, oh, if you have crooked teeth, you do braces and no one's judging you for doing braces, because you're like, I want a little.
You do that in 7-year-olds. You know what I mean? I mean, that's what's crazy. Like we do that and we don't even. Yeah, the dentist tells you it's functional, but that's BS. They know they just want a nice, beautiful smile. I mean, that's a good point. I never thought of it that way, to be honest.
No, I like what Katie's saying. If we could just stay on that point for a moment, because I think it's really important. Which is, okay, we get our teeth fixed, we get our hair cut, we shave. I mean, is that, yeah, except for you, Ben, because you got the Chicago fireman thing going on. But like, I think that's not that much far afield from that. Like when you actually think about it, we are doing these kind of things all the time. Katie, why do you think there is a stigma as soon as we're going to go to a Botox or a filler or something like that that's going to just do something that's more de-aging than just beautifying, which seems to be completely accepted?
I think it's a little bit society and what, as we said, some of those loud voices say or make you feel, right? And we see that in all areas, right? People will feel very strongly like, oh, you should go, quote, natural. They may be dyeing their hair, but they're not, quote, natural in their face or whatever it may be, right? So I think some of that is perception, as we talked about, pushback from particularly injectables on them looking unnatural. And so those few sort of perceptions of the people, the celebrities that they've seen that look unnatural, they presume people who get injectables might also look like that or want that. And so there's just a little bit of that. I do see it shifting though. I think the younger generations coming in are a little bit more pro talking about their self-care strategies and talking about their skincare regimens and then talking about the aesthetic treatments they do. So there's a little bit of a shift happening in acceptance around, hey, this is me, this is my own body, I can make my choices.
You know, it's interesting. My 9-year-old said to me the other day, do you still help people or do you just make them prettier? And, you know, I was like, nah, I pretty much just make them prettier now. But to her, because I was being honest. But, I mean, you know, I used to do these big trauma cases. I used to do this head and neck cancer. And I'll tell you, and I don't know if this is good or bad from a societal perspective, but I really feel like I've changed more lives aesthetically than I mean, of course, if somebody had a cancer, we cut it out, we saved them. You could argue that was better. But the number of times I've had people say, man, this has changed my life, Dr. C. My confidence is at a new level. Like, oh my God, this woman left me like a voice message. She got in med school because she think it totally changed her, the way she, presented herself. I mean, in my answer normally to the haters, like on social media that say, oh my God, this guy's just cutting people open for no reason. It's like, man, don't hate the player, hate the game. The fact that people who look good, feel good, and somehow they get more confidence, you really can make somebody significantly happier by adjusting the way they look, which then therefore adjusts the way they feel. I mean, it's kind of impressive. In a way, you could argue that it's a little bit sad almost, right? Like you got to be hot to feel good, but I don't know. Man, that's how the world works.
I think I want to let Katie comment on that, but I just think we always say we're in the feel good business. We're not in the look good business. We're actually in the feel good business is what we are at the end. Katie, I don't know what your thoughts are on that.
Yeah, I mean, really, it comes down to a lot of it is self-esteem and confidence, right? Confidence in your skin, confidence in how you look. And, you know, we're all doing things to make us feel better. Like we want that, right? It's like why we exercise and try to get a good night's sleep and do these little tweaks and things with, aesthetics. It's why when people get dressed up and put on a outfit they feel good on, you can walk down the street and be like, oh, I feel good. And so I totally agree with that point in that I think it's so rewarding in what we do to see that. And it's societal. Like people, when they look good and they feel good, they display confidence. We know from the literature that they have better jobs. People's perceptions of them change. Like that person must be confident. They must be successful. They must be healthy. Not even a question of like, we will judge people's health status based on how they look and whether they may have disease states. Right. And so it does impact, I think, multiple levels of our lives. And so, I mean, that's making a big statement out of like the things that we do, but I think that little bit of like, I feel good in my skin today. Like that makes a difference.
That's really good. Sorry, Ben, were you going to say something on that?
No, I love it. I think it's one of those things it can be I'm impressed by how much making people a little bit hotter makes them that much happier. Like truly,
Hotter's happier. Is that big bumper sticker? Is that where we're going?
You got to be careful how you say it, because then
I'm like,
where we're going with?
All the ugly people are going to comment that that's not fair, but I mean, there's options.
Well, you can help them, Ben. Katie, I don't want to embarrass you, but we have to say it, but I have a point of this because I actually want to know how. Katie has the most beautiful neck that anyone has ever seen, by the way. It's literally perfect. And I noticed it. I actually leaned over to one of our doctors while Katie was on stage. I was like, Katie literally has like the most beautiful neck in the business. Katie, what do you do to your neck? What the heck is happening with your neck? It's not, by the way,
the deep dive question we're going to go into is the neck treatment plan.
I do. I want to know what your neck treatment is. And it's not that the rest of you is not beautiful, but it's just so perfect. What is going on with the neck?
I mean, listen, I have to try all the things that I preach to patients, right? So when everyone's like, oh, have you tried it? I'm like, of course I've tried it. Like, I've got to be able to see what these treatments do. So, I mean, listen, I do my skincare from my face down onto my neck, chest. Like, that's important. I do believe in that as a dermatologist. And so protecting it from the sun, of course. So bare basics. So I'll take like vitamin C, I'll do a low potency retinol, I'll do my sunscreen on my neck and chest. And then I do lasers and devices on my neck for skin tightening. So I've done a range, but I typically will do a once a year ultrasound alt therapy device on my neck. I'll do IPL, Tixel, Clear and Brilliant. Over the years, I try and do at least 1 or 2 lasers a year. That's like surface-based laser, and then a deeper skin tightening once a year. And then intermittently, I will do neuromodulator in my neck to snap things up, the so-called Nefertiti lift. So that's really common to kind of help prevent those bands that go down and kind of snap up the jawline. And then my wonderful colleague, Shannon Humphrey, who I practice with, has done little micro droplets of hyaluronic acid, like Skin Vive in my neck as well. So I've dabbled in a lot of the things.
Well, no, I mean, it's amazing. And thanks for sharing that. And I guess one thing is you mentioned several devices while you were talking. Do you have like a go-to that you now really love, or is it constantly changing because as the devices come out? Like where are you at with that?
I mean, for patients, it depends on their needs, right? So it's so hard to pick like a favorite. I'd say currently we're doing a lot of Tixel, which is a device in our practice that is fractionated heat. And so we do a lot of that for areas that you get that crepey, crinkly skin. And so around the eye area and down onto the neck, it's been very popular and really beautiful results. And you can do topical drug delivery, or for example, put PRP on top after to kind of enhance the results. So that lately, some of our before and afters are just phenomenal and patients have a lot of satisfaction. And I also think just in general, there's a lot of conversation, or patients will often come in talking about their face, right? Their concerns about facial skin. And when we talk to them and we do a consultation, we always talk about the neck, chest, sometimes the hands, because these are the areas that I think sometimes we forget, and it's harder to repair and treat than it is to sort of try and do as much as we can for prevention earlier on.
That's good to know. Okay, next time I'm in town, I want to know if I went off the cliff. I want to know if I'm beyond the point of no return.
We'll just go see Ben.
Yeah.
On the neck. Yes.
Just wait till it gets bad enough to say.
Yeah, that's when it's really bad, I'm going to go see. Katie, so I can talk to you about this stuff forever, but I don't want to miss some of the other stuff. So if we go random on here, back and forth, if that's okay. I want to talk about, if we can, just kind of your own journey into longevity. You and I had a conversation a little bit about this, and I just want to know just where your head's at now. You're always reading, I know, and researching and whatnot. Tell us kind of just what you're doing just from overall longevity.
Okay, yeah. So sleep, nutrition, exercise, like core for me. And I do try to be thoughtful on that. I'm always like reading. Go ahead. Yeah.
That's not in order of necessity, I assume.
No, but those 3 things, like I used to be like the typical physician where like I would cut sleep and, not be mindful of it. And I would be able to do fine and practice. And my mind was still, but now I just know that when I get good quality sleep and what the literature tells me, I just focus on that a little more.
And do you have like a sleep hygiene kind of routine that you stick to?
Listen, I'm not as good as all the people that do like the full no phones, everything right before bed, but I do try to wind down before bed. I do like just read an actual like paper novel just to like not be reading a screen. And I do try to wind down a little bit. And then I take magnesium, like I listen to some of the supplements that have a little bit of support. I do have an Aura ring that I use and have had for years that kind of just helps guide me. Some people will get obsessive with it, but at least I can see how I'm generally tracking in terms of my sleep and my heart rate at night. So those would be key things there.
I think I've seen on your gram, I don't know if it's a cold plunge, sauna.
Oh yeah, I do have both of those. Yeah.
I just put a sauna on my roof and like, I think it's really changed the game from my sleep
Yeah.
perspective. Yeah.
So definitely there's evidence for sauna use with helping with sleep, cardiovascular health as well. And so I do use my sauna intermittently as well. And I haven't been as good as like the routine where some people like sauna every night and then go to sleep. But I'm not that good, but I do love the sauna.
That's my thing. It's like my wind down at night. And it's beautiful because there's like such a built-in no phone. Mine's like a Finnish sauna, so you can't take anything else in there. Like it doesn't catch on fire, but you can't hold anything in your hands. You know what I mean? It gets that hot. So
Well, and the thing is, like, we almost need that, right? Like, I find where I'm most creative sometimes is like in the shower or the sauna because I'm not like listening to a podcast or doing something else that's distracting my mind slightly, right? So there's an advantage to that.
Yeah, and Ben, I like you mentioned last time, like you and your wife sauna. It's your time to like hang out, which is cool. Like you actually get quiet time because what else are you gonna do? You're gonna have a TV on. You get a chance to hang out, sauna, talk. It's really awesome. So, that's great. So we mentioned sleep. So we had a lot of conversations just about sleep. I just heard we got sauna and a cold plunge. Do you do that often?
I used to cold plunge more and my husband's more into it than I like our sauna cold plunges out there, but I have Raynaud's and I was finding like I would just get so cold. And so I'm like better or more, I'd say mindful because I'm a bit competitive in my head. And so I was like doing cold plunges, like being like, yeah, I can do 4 minutes, no problem. And then I was like, okay, like now I cannot warm up for a long time. So I cold plunge, but not as frequently as I used to.
Okay, that's good. And then
are you into the cold plunge?
You know what? I don't have one. There's the literature still out on the cold plunge.
The cold plunge is not as robust. Like I think for some people, and there's a little bit more like men in terms of like, so Ben, my husband, like he'll jump in and get ready for the day. Like it'll invigorate him. And that I think is a role for it, I'd say, but there's not as much data for it.
Yeah. And there's some muscle recovery stuff they thought was awesome. And then they're like, oh, maybe it's hurting your recovery. So yeah, I'm not there yet. It gets cold enough in Chicago that, half the year I can go outside after my son.
The best part of the cold plunge is just the mood enhancer. More
Do you
than
have cold plunge,
else.
Dom, or just
I don't, but even a very cold shower, and especially because you live in Chicago and I live in Toronto in the winter, that's real cold water coming through there. And it's a total mood enhancer. Yeah. So that's awesome.
Mood, stress, anxiety, the cold plunge, I think has got that one.
Yeah.
And there was a bit of data on preventing colds, and I can't remember it was in a cold shower. Actually, it was limited data, but then I was like, ooh, and I did a cold shower every morning for a period of time, and I didn't get a cold, and I was like, this is, and who knows, like, right? You're like, is it in my hot mind? Yeah. But there was a smidge of literature on that.
And you have young kids, right, Katie?
Yes. Well, I mean, they're 8 and 10, almost 8 and 10 now.
Yeah, but kind of booger nose face.
Yeah, you get all the germs from school.
And fitness, you're working out, you're exercising.
I try to
anything that
balance.
you love there, like special.
So I have a Peloton tread and a Peloton bike and like weights and, bar and all that. And so I'm definitely over the years have leaned into strength more. Again, typical old school way was like cardio and you'd go work out forever. So I'm definitely leaning into strength more. And then I do hit like high intensity sprinting, once or twice a week. And women, you don't want to spike your cortisol too much. So it's a balance. And again, I watch myself because I'll be like, I can sprint for longer. And then the other thing that I do that's my like little work trick is trying to just get like after work, when you're tired and you're like, do I really want to get a workout in? But on my Peloton bike, I have a laptop stand. And so I will just like I also have the Morpheus heart rate monitor. And so I'll get myself into zone 2 and I'll just like fire off emails, finish charts. And it's like, it feels productive. I feel great after, but I like got some work done at the same time when you're like, I have too much to do to do anything. So I will do that for zone 2, kind of get a little workout in.
That's awesome. And last thing is there a morning routine that you stick to?
For a workout?
Just life. Just, is there a morning?
We start work as here at our clinic. We start at 7 a.m.
Damn.
So yeah, so we're up early. So my
Freaking
morning
Canadians, man. What the 7 a.m.? Who the hell's going to get filler and Botox at 7 a.m.?
7:30 the appointments start, and we do like a team meeting first. And I tell you, people, it's like over the years, all our patients have been trained. They like to come in, get it done right before work, and then they're out. So, but the power of that is, we have a lot of women in our office who work, and we're done at 3. So you're home for your kids. You're not rushing for dinner. You can catch up on stuff. So that sort of 7 to 3 is a good sweet spot for us.
Yeah. That's I've noticed, I don't know, the past 5 years with the work from home or the flexibility, almost everybody's to some level other than us, like hybrid, right? So we see less of that, time restriction that we used to get lunch hour Botox. We used to get, there's much less of that now, I think, because people they can flex. They can I had a guy during surgery made my nurse flick his phone so he didn't go green or whatever color they go on Outlook. So like every 20 minutes he would say, "Did you do that?" Would make her do it. So he got a work day while he was getting his surgery. So,
Yeah, you want to show that it was off.
Yeah, exactly.
Katie, how are you?
I love it. I love the efficiency.
How are you managing like being a spouse and a mom? I know you work a bunch and you're so busy just kind of what you're doing, and then you're doing all this work for everybody wants you to speak and you're a key opinion leader out there for all that. How you balancing all that?
I mean, yeah, we always are like balance, right? What is balance? I think the key for me is like, I love what I do in all the different avenues. And, I'm not only in clinic, and I get to dabble in like the social media creative stuff, the KOL and speaking stuff. But I have support, right? Like my husband works from home. He primarily works with me. So that kind of helps to balance that avenue. We still have a part-time nanny. So I'm very grateful for that, because the driving, as we know, with kids and all their activities is sometimes like the biggest challenge is like, who's going to volleyball? And then we're going to basketball, and it's just all of those things. And so I think, what I try to be is present in each of those spaces when I'm there, and also giving myself grace that I'm not going to always be perfect. And you're like, okay, could have done that week better, or repair if I need to be like, okay, sorry, like wasn't my best self in that particular avenue this week. But I feel like I have a much better handle on it, the further along you go and you start to little things come up. But I think it's just the passion in each of those areas that I love.
Yeah, Dom and I both talked about it. That's one of the, I think you brought it up, the balance. I mean, it's not a teeter-totter. Like it can never be level, right? You're always way up on one, or at least me, I'm always way up on one, or like today, actually my nanny, I was coming home. I was like, Dom, I'm going to be late. And I was like, oh fuck, Marisol, you got to pick up Maya. I'm not going to be able to get her from gymnastics. So it was just like a total fail from the home perspective. But it is what it is. But I did a great surgery. The office is going to be happy. We had a great case. So, but there's always one way up or one way down on my side.
Yeah. And I think just understanding that, like, if you live in guilt, like I didn't make it to that event, or it's not helpful to anyone. Right. And so recognizing your strengths, and yes, obviously you have to recalibrate every now and then. Inevitably, it's like the fall hits, and it's like, yes, I'll say yes to that, and I'll say yes to that, and I'll say yes to that. And it sort of piles up. And so you're like, ooh, now I'm going to need like a little breather and say no to a few things and be present a little bit more. So I think just recognizing that and recalibrating when you need to.
Oh, we can't stop talking about MD hyperbaric. We can't stop talking about the benefits of MD hyperbaric. Ben, I don't know about you, but I'm tired all the time. And the only cure for that, either some medical grade drugs or just going to the hyperbaric chamber. Do you think, right?
It's like taking a deep breath on steroids, it's like, but if they jam it in every cell. And not only that, there's an anti-inflammatory component. If you were to have any injury or surgery or anything like that, boom, it's science. It's that simple. It's going to make it better, faster, smoother.
Yeah. And I think a lot of people don't realize that it does all these different things. I mean, there's all kinds of people complaining about chronic pain, chronic fatigue, these kind of things. It just does so many different things. MD hyperbaric has the right type of chambers. Don't settle for anything less than something that's more of a medical grade chamber. They are in so many different locations. Make sure that you go to mdhyperbaric.com to check them out. You could even tell them that Ben and Dom sent you from More You.
mdhyperbaric.com.
That's
a really good insight.
Yeah, I like what you said there about the feeling guilty about it's not helping anybody, because I'm just feeling guilty all the time. Like I'm feeling guilty, especially because I travel a lot and, you're there, but you're right. That's actually not helping anybody. That's not serving any purpose.
Not serving any purpose. And like for my kids, I just lean into what I do. And I'm like, I am so excited. I get this opportunity and, and I tell them about it. And I'm like, I know that means I'm not here, but like, this is so cool. And I want them to celebrate me having these opportunities and being like, whoa, my mom is out there like crushing it. Like, that's awesome. And they know like, okay, cool. We're going to have dad time, or like, whoa, we're going to watch the Avengers movies, mom. Cause and like, they'll get excited in their own way of like, mom's gone. So yeah, I think I've been much better at just being like, no guilt. Like, this is who I am. I love what I do. And I don't want to, you see the quote, stay at home moms, or I show up at the school and they're like, well, who? I'm like,
who the hell's this chick?
I'm like Jacob Henry's mom. Like, they're like, what? Who's this lady? And like, I need to sign something. I'm like, I've actually been here for like 9 years, right? But that's okay. Like, me being there for pickup isn't where I want to lean into for like the important moments for me and my son's time together, right? So you just pick and choose, and I'm like, I'm not going to feel guilty about it.
I like that. That's good insight.
Yeah, but the other thing that I was going to say, one other like tip that I do is I try not to say yes to something that I wouldn't want to do tomorrow. You know how like, do you guys find this?
Oh, yes. I know exactly what you're talking about.
And you're like, oh yeah, sure. And it's like 4 months down the road. But if that were coming up this next week, you'd be like, why did I say yes to doing that? So I just try to like take a beat with every decision before I say yes to it, whether I truly want to do it.
Yeah. And Katie, you said a really important thing there in that it's really important for your kids. And you may think that an 8-year-old and a 10-year-old don't understand certain things, but what they can understand is effort, and they can understand winning, and they can understand that, they can understand happiness and excitement and being able to see that in your eyes. And I think that's really, really important that you share those things, obviously, with them. I remember when I was starting this platform, I took my family out to dinner and I said, guys, this is a once in a million thing that can happen in a lifetime. And it's actually happening. Here's what this means for our family. And here's the sacrifice that it's going to also mean. And we literally had a full conversation about it. And my 3 kids were like right in there on the conversation on, well, what does that mean about this? And what does it mean about that? And, we talked out ahead of time. And I think that made a huge difference in that, right? So I like what you said.
Yeah, and I'll honestly get my kids to weigh in on some of my decisions. I'm like, oh, I got this opportunity. It means I have to go to like Europe or wherever, and they're like, okay, mom, tell me more. Like, I just try to have those adult conversations with them, to be honest, even at this stage. Like, if there's something that I'd have to miss, or how are they feeling? Do they need me more? And my kids, like, they're, I think, emotional intelligence around how are we feeling? How connected am I with mom? Like, they are open with me about what they need, which is really lovely, I think, for me.
That's awesome. And speaking of that, Katie, like, you've done such a great job building a brand. You have this great brand that you built. I know you work hard at it. How did that come to be? Was it intentional, or did it start just like, I got to do this, and then you started finding your way? Can you take us through that a little bit?
Yeah, I mean, I think, as many things it started off a little bit back around the time of COVID, really. And, we weren't in clinic, and, I had been sort of working my way up on the more, I'd say, academic trajectory with speaking at conferences and all of that. And that avenue was kind of shut down. And I was like, wow, what is the future? Like, how do I communicate who I am and what I do? How do I educate in this space? And so I started, playing in the social media space a little bit at that time. And my husband is a digital media marketer. Like, he's a business guy. He's from Silicon Valley, grew up in tech. And so he was a huge proponent of being like, hey, this is a way to like talk about you and who you are and what you do. And so really supported on that front, because it's hard as a physician to kind of dabble in this unknown space when you're kind of used to being very professional in this avenue, right? And be like, oh, I'm going to be creative and put up a video about me. It just feels a little daunting. So that was kind of how I got started.
Very cool. And then was there any kind of inflection point where all of a sudden, you know, things really started picking up, or was it a slow grind kind of?
Oh, slow grind, I think, just a grind in the, you know, and you'll have like the thing about social media, and Ben can speak to this too. It's like you're grinding out, you're like posting, you feel so good about the stuff, and then it's like nothing resonates. And then every now and then they'll give you like a little blip or something like takes off, and you're like, yes,
they know what they're doing. Yeah,
they know what they're doing. They hook you back in, and you're
like,
oh, okay, I'll keep going at it. But for me, it was nice. Like, I'd say the nice thing about my role in social media is that I kind of get to dabble a bit. Like, part of it is just to show my patients, my existing patients, my life, right? And who I am and what we're doing. And I know that helps them feel connected to me. And they're like, oh my gosh, I saw you doing this. And it reminds them of me, and they want to come back in and see me, and they feel, you know, we're connected in that way. So that was one avenue. And then I got to educate on skincare, and there's so many consumers and patients that are so interested in skin health and so confused by all the, you know, myths that are out there.
Yeah, I would say everybody's interested in it, or should be, and there is plenty. And then there's a lot of bad information out there. So there's, I forget the phrase they use, but this like megaphone component to people that have no legitimate reason to be giving advice on these sorts of things. I think skincare cosmetics, skincare, whatever, is one of the probably most portions of our field that like it's just got such nonsense out there. And a lot of the biggest people that have the most power know the least. So somebody like you getting involved and getting your voice out there is huge, because it's good, medical, solid, you know, legitimate information.
Right. And I think, yeah, it is. And as we know, like some of the clickbait and the viral stuff is the stuff that's like the wildest, like this, you know, sunscreen is going to give you cancer, and like, oh, and people are like, oh my God, you know, it drives views and more people hear it. And as we know, sometimes the loudest voices make people think that that's what the majority believes, when really it's such a small proportion, especially in social media. So yeah, I mean, that was an avenue that I think helped build my brand, in that it's like, okay, she's out there trying to fight the good fight, talking about skincare, educating on it. And then of course, educating and interweaving aesthetic procedures and cosmetic treatments and what they do and how they can look natural, and other things that we're trying to bust myths about as well.
Do you know my favorite part of it, when I have younger people asking me advice, like how to build a practice, how to build a brand? The beauty of the social media space, it's you can do something, you know what I mean? Like, it's pure effort. There's not any money involved other than your time. So it's like, it's what I can do to make sure I get leads. I mean, I'm putting it out there. I'm getting the information. I have a little cadence to mine like you, but it's very, you can be very competitive with it. You know, right now I'm posting 3 times a day. It's crazy. It's like, it's exhausting, but I'm like, I'm doing it because it works. I mean, I'm like looking at my data. I'm like, man, the more I post, the more I get. I'm going to keep going. So it's just a really nice feedback loop from a more of like business cosmetic perspective than actually physician. But I think it's motivating in that way. And it's something we can do other than treating people good, getting word of mouth. I mean, we're going to do no matter what. But this one is one that I think there's an effort, put in effort, get outcome out of the similar effort. It's like, you know, if you practice sprinting every day, you're going to get better at it. This one, if you do it more and more, you're going to get more leads. You're going to build your brand. It's going to get better. So it's satisfying in that way, I think.
Yeah. And I think even if people who are new to the social media space are overwhelmed because they're like, oh man, like I have so few followers. I'm like, but it's still like a search engine, right? And that's really where people are going to look for information now. So they want to know a little bit about you and they want to see who you are and what makes you tick and what your work's like. And, you know, every day I have a patient coming in who's like, I followed you for like 3 years.
Yeah.
And I finally was ready. And,
exactly.
you know, and you're like, okay, that's awesome. Like, thank you for being there. there and, coming along with the journey.
And it's reassuring, right? Yeah. Same thing. Oh, I've been following you for 10 years. I'm following. It's like, I mean, that's beautiful. Like, I mean, if you can put that math in your head, like you've got all this stock in the back. I mean, that's really what the brand is that you've built for yourself. I mean, I don't know if brand is the right term in our scenario, but it is that kind of equity that you've built in yourself. So that's good job.
Katie, we like to ask two questions always. These are two questions. So you can think about this. Let's do the first one, which is, is there a treatment, product, whatever out there that you believe is just magic, that you think is just incredible, that people should know about, that, people should have? Is there something in particular that you just kind of go, yeah, that works? That actually comes as advertised. It really works.
I mean, because of the backlash, I'm going to say HA filler, like hyaluronic acid. And I mean, we've talked about the word filler only in that it is magic. And when you do it right and you use it in these beautiful planes to just redrape tissues, to subtly enhance, to, it's been around for a long time. It's safe. We can use it diligently, cautiously, with great, beautiful, natural cosmetic outcomes. And I just say that because I think there's some people who've developed a fear. And it's like, if you had to pick one tool, like, what can I do? I can do a half face and show you in a mirror and be like, take a look at that little difference. And they're so happy. And so, yes, that may be not anything new, of course, but I think that, and in my hands, combination treatment with other things, it's, beautiful.
Listen, all of this stuff can be done amazing, and it can all be done really poorly. So that's what you're looking at. That's why this is such a contrasting issue, the filler, because there's some people doing it amazing. There's some people doing it very poorly. So
I just love that you came out and
you're one of the ones doing amazing.
Yeah, you are. And I like the way, you describe why that is the case. Because it actually does create a wow. It creates a wow for the individual. Let's take it to the other side. There, in our world here, we are confronted all the time with all these new things. Oxygenated facials, salmon sperm facials, this, that, the other thing. Like, what do you look at and go, oh, that's not real?
I mean, there's a lot of stuff that, a lot of people ask me like, oh, what about a facial? I'm like, if a facial makes you feel great, like go for it. Right. But I don't think there's a long lasting component to a lot of quote facials or these things that, are very superficial or just on the skin. For example, even masking, people love a good face mask, like, the leave-on ones. And I'm like, that's cool, but it's not as good as consistent long-term skincare, right? Or your in-depth cosmetic procedures that you would do in office. So I think it's just recognizing what things are for what they are, right? Like, what will you truly get out of some of these new fad, masks or facials that come out. Yes, I know there's a lot of interest and buzz in the longevity space, regenerative aesthetics, PDGR, like all the salmon sperm, etc. And I think a lot of that is, yes, I think there's something to regenerative aesthetics. People want to stimulate their body's own collagen and elastin and have healthy tissue long-term that's long-lasting. I think there's a lot of things that are being used that have limited data. And as you know, with me, I'm like, show me the science. I need to understand the why behind the products, the belief in it. I want to see histology. So I want to know a little bit more before I would implement some of these treatments in terms of the science perspective.
I think there's a lot of people that are walking into clinics that don't have that same, let's say, rigor around the products and treatments that they're providing, based on the fact that there's evidence to back up the results that they're promising. What do you think a patient should look for, ask for? What questions should they be asking if they're walking into a clinic and before someone's going to go and stick a needle in their face or, use a device on them? What would you suggest?
Yeah, I think a lot of it is that, initial conversation or consultation with that office or, healthcare professional, like, who's doing my treatment? Who are they? Obviously, understanding, are they, board certified? Do they have training? And I know that's hard to decipher for a lot of people because many people will credential themselves in different ways. But I think you want to understand their training and knowledge in the area. You want to feel comfortable and develop trust with that provider that you're talking to, right? Ask them the questions about the treatment. Ask them about the science. I want my person to give me that education about that treatment in a way that clearly outlines they understand the why. And I would want to do a little research around those treatments if it were my first time or something new as well. And then the other big thing, is making sure like you're in a place from a safety perspective, right? It feels professional. There is medical history that's taken. These are medical procedures we're doing. And so I had a patient who came in and she's like, I always thought it was odd when I went to this place and like the tip jar was in the room. And I was like, a tip jar in a healthcare professional's office to get cosmetic procedures on your face. Like, you want this to feel medical. You want to know that they can manage complications. They review with you side effects. There's proper consenting and informed consent for procedures. I know I'm throwing a lot at that, but it is something where I think research and knowledge is power and important.
I wanted to see, I know we're crunching on time here a little bit, but these new regulations, I think Texas came out with one. We kind of talked about it briefly, Dom. Florida also has some new regulations on who can do these types of things. Australia, I think, like really cracked down that it has to be an MD, I believe. The UK also did something very recently. I mean, you can see this spreading around the world, essentially. Like, do you have any insights? I'm not really up onto all of the changes, but do you have any insights onto that?
I do think it's going to evolve. We're seeing more of that. I just was giving some lectures and talks in the UK, and it's like the Wild West there still. And when I was giving the talks, they're like, no, Katie.
Like more so than the US?
Oh, way more
Really?
so. Like hairdressers can inject, and there's no regulation on what they can inject, but how you talk about it is highly regulated, which is a very unique situation. But so even as I was giving my talks, they were like, no, Katie, like dumb it down more. And I'm like, oh, like it was like I had to describe the skin and what the skin is, because injectors there, the level is just different and the regulation is different, right? And so it's very different than different parts of the world. But as you say, I do think it's shifting, that there is a move to try and enforce some regulation. It's just so hard because, as you know, like even in different residency programs, there's different levels of training, and there's not a standard quote fellowship that you would do to prove you were an expert, right? And so it's a challenging area.
Yeah, and I think one thing I'd mention is Katie's in British Columbia, where of course, doctors can inject, but nurses can't inject unless the doctor is on premise. And that is almost the strictest regulation that I've seen in North America, other than Alabama, where only doctors can inject in the state of Alabama. That's it. If you're not a doctor, you're not injecting.
I think Illinois might have come out with something with having to be on site with the nurses. I mean, most places are going to have the doctor on site, I would say, other than the real little...
Well, there's actually, you'd be surprised. I mean, there are so many states where you just need a medical director. Basically, you need a medical director on the business. There are plenty of businesses out there, and I think people should hear this. There are plenty of businesses out there where the medical director is never there, has maybe been there one time, but has never been there.
I know I had this nurse who was like, oh, my friend who's a rheumatologist is going to be my medical director. I was like, oh, does he do aesthetics? She's like, no. I'm like, well, I mean, why would he be the medical director of an aesthetics place if he doesn't do any aesthetics? And it's just like an MD. She probably gives him $500 a month, and he's the medical director. I was like, what the hell? Why would he even want to do that?
From what I hear, like it's quite common.
I don't know why anybody would. Yeah, this doesn't make sense.
But you don't know what you don't know. So I think people taking on those medical director positions, they don't necessarily know the risk, right? Like, and we see it all the time with people who've run into complications and don't even stock hyaluronidase or have enough hyaluronidase. And you're like, geez, like you're injecting, but not actually prepared to manage a complication related to that, or have no after hours contact information, right? And, people are going to emerge with complications, and, so it is a really scary area there.
Yeah, we found a medical director in Florida that was on 34 clinics. They were the medical director of record on 34 clinics. Yeah. Never been to any of them.
Yeah, I'm sure they're not on site.
No.
A guy from Florida is what they say, I think, right?
Yeah, it's some guy from Florida. Katie, thank you so much. We're looking forward to part 2 with you in the future. Thanks for doing this.
For sure. Anytime, you guys. Have fun on the next episode.
We will. Thanks, Katie.
Okay, bye, guys.